I mean, proparacaine in the right eye. Now, when I put it in, look way up high.
The instruments for various methods for ROP examination include lid speculum, scleral depressors, and a gonio lens, in addition to the indirect ophthalmoscope and the direct ophthalmoscope.
You've got nicely dilated eyes. Super. The see-through, that'll be pretty bright.
And the pain and
What a beautiful eye.
Mm-hmm.
There you go. Good job. Heart rate is 61.
Okay.
This is the Runji. Down a little bit. Good. Nice.
This is the indirect ophthalmoscope on low mag. This is turning it all the way up. There's low mag. Here's turning it all the way up. Full bright.
This is the see-through scleral depressor full light.
Mm-hmm. Okay, I would say 4 discomfort, and that was probably like an 8.
And the Alfonso with the feeling eye.
That is like a
8.
5.
This is the see-through.
I'm going to slip mine in. And perfect.
That's an 8.
Oh, really?
18.
Huh. And look to the left.
That's
Okay.
a 7. It's my friend Bob Harrod who sort of developed these. And he kind of, I'm pretty sure this one was sort of responding to people's interest in staying with the Alfonso. This is the Moria scleral depressor. Look down, just a little down, and there you go, perfect. Really nice.
The plastic one.
Mm-hmm.
But you like the handle to go out a little more angle that way.
Yeah, there's
I'd
room.
say-
There's room to hold it further out.
Yeah, yeah.
Right?
Good job. Okay, now this is the direct ophthalmoscope.
This is the direct ophthalmoscope.
Now this may seem pretty bright.
Yeah, it's actually, that's pretty bright actually. I think the brightness around a 10 on this sucker, or a 9 anyway, yeah. It's interesting. I mean, it's interesting, but it's bright, but it's not, not painful.
The Phoenix Icon camera. We compare all the different methods for ROP examination with those ranked by pain vertically and brightness horizontally. From this, we find most have a normal distribution of data, and we use this to highlight the actual lux measurements of brightness. For each intersecting comparison, we find those things that are similar in orange and those that differ in blue. For instance, for Runji Num, we compare it to Moria Num and find that they are very similar, which is also true for the see-through Num, for the Gonio Direct Num, for the Moria Scleral Depressor Num, and the Runji Plastic Num. On the other hand, when we compare feeling Runji, we got a different measurement not only of pain but also of brightness. We did notice that when we used full bright, we got an increased measure in brightness with see-through scleral depressor, but the Alfonso with similar light increased its brightness when we did not have topical anesthesia. That was also true true for the see-through scleral depressor and the Runge scleral depressor. In a similar manner, see-through scleral depression seemed to have more pain with full brightness. We can look at box plots comparing all measures with pain and brightness, but since they're normally distributed, we can measure them using t-tests like this. For those that did not have topical anesthesia, we noticed the increased amount of pain, as with dilating drops. And for brightness, the direct ophthalmoscope, the indirect ophthalmoscope on full bright, and the Phoenix Icon were all very bright. As far as oculocardiac reflex, we measured it with a special monitor that was able to transmit information to an iPad. We measured the percent oculocardiac reflex and found with all the different maneuvers, there was a minimal difference between all of them and no significant oculocardiac reflex. As far as pain with lid speculum, the Moria and the Alfonso with topical anesthesia had similar amount of pain, but when we did not use topical anesthesia, there was increased pain. As far as brightness, the see-through scleral depressor appeared to have increased sensation of brightness when the patient was feeling. This is also true when we combine the see-through scleral depressor with the Runge scleral depressor. There was more brightness sensed without topical anesthesia. Measuring pain and the influence of bright light on pain using the same scleral depressor, the increased brightness of the indirect exam resulted in a small but not significant increase in pain. Concerned adults preferred topical anesthesia and decreased brightness for exams.